Welcome to the show, everybody. This is Beyond the Limits, and I hope you enjoyed that very swanky intro. Matt, I'm really impressed by whatever tech you've done there, but this is starting to look like a really professional operation.
So your sarcasm weighs heavy on me, but I like that you mentioned tech because this episode is exploring some very interesting new tech, isn't it, Mike?
It is. So today we are going to be talking about something that is got a lot of buzz and a lot of interest in the medical world. There are loads of companies offering scans, offering assessments for health-conscious people with the approach, I guess, of thinking, well, prevention is better than the cure. Now, we're going to talk specifically about Neko Health, which I think is really interesting. And very excitingly, I had the opportunity to try out a Neko Health scan. So I went on a bit of a field trip, and we're going to delve into that and talk about my experience. So I just want to say a massive thank you to Neko Health.
Yeah, I second that. I'm very appreciative of letting you go along. I'm a little bit bitter that I didn't get the call up as well, but I live in Bristol, so maybe there's going to be a Neko opening in Bristol soon. I like the way you framed the whole preventative healthcare thing. I think this is a really important movement, isn't it, that's happening probably too slowly, really, isn't it? I mean, we talk about how dentists arrange checkups every year, maybe 6 monthly, but no one really looks at your heart until you have a heart attack. And I think this movement to understanding that maybe we could prevent some disease is really important. I think us as GPs, we've been at the vanguard of this for several years, but probably struggling to achieve this in a meaningful way because of how resource constrained and how time pressured we are now. So enter in new private companies and private business who are offering preventative health screening. And I'm very excited to talk this through, Mike, because there's so much mystery around these beautiful looking scanning clinics. And I can't wait to kind of dig into this and understand your experience further.
You say mystery. It's really interesting because exactly that. I'll be honest. I kind of thought I've heard about Neko Health for a while, and I got it completely wrong. I thought it was this, you're going in, you're getting a full MRI of your entire body, and then you leave. And actually, there are companies that offer that, but that's actually not what this is. Do you want to give us a little bit of background, Matt? I know you've looked into a little bit about the genesis of this company and what they're trying to do.
Yeah, okay. So Neko, I was pronouncing it Neko for a very long time, but I've listened to the founder, or one of the founders, I should say, Hjalmar Nilsson is his name, speaking on another podcast about his company. It's a Swedish company based in Stockholm. They are offering full body scans, and I'll leave that intentionally vague for the time being as to what a scan is. They're spreading very, very rapidly, and they have launched in the UK. I think they've been running since 2018, but they've now got 3 sites in the UK. They've got 2 in London and 1 in Manchester, and I think they're expanding quite rapidly. There is a huge, huge waiting list to get one of these scans. When I heard him talk about it on the podcast, he said there was over 100,000 people on the waiting list, and that might have changed in the interim. They are focusing on early prevention, and they've got a lot of proprietary technology that they have developed with the aim of detecting disease much earlier. It's probably worth me mentioning as well that Hjalmar Nilsson is one of the co-founders, and he's partnered up with Daniel Ek. And for anyone who doesn't know, he's the founder of Spotify, and I think most people, unless you've been living under a rock, know about Spotify and the success of Spotify. So it's got some huge, huge, huge backers with probably very deep pockets. That's probably them in a bit of a nutshell.
We're going to dive into this and obviously talk about the experience and what they offer. I think this is going to spark a little bit of a debate because I think there are some ethical considerations with this. There are some interesting scientific considerations in terms of what they're offering. So I'm hoping we're going to lift the lid and be able to offer quite a balanced view on these type of scans. And I guess we can speculate as to what the future holds, perhaps.
Yes, absolutely. I'm going to try and be on my best behaviour here because I've got a fairly healthy dose of cynicism and skepticism lined up, but I'm aware that they're not present to defend themselves. So let's dig into it, shall we, Mike? I think it would be a good way to approach this by just talking us through a little bit about your experience and maybe going through the steps of what's involved in you having this scan and what you experienced. So, how did it start?
Are we going to play the video? I made this very cringe video.
Let's play the video, definitely. Let's play the video.
Hey guys, Mike here, doing my best middle-aged influencer impression. I've just arrived at Neko Health. And when I say arrived at Neko Health, I mean I'm hiding down an alleyway because this is possibly the most cringe-worthy thing I've ever done. But excited to go in, excited to see what this is all about. And I've remembered to wear my dark, non-see-through underwear as requested, which is information that I suspect you neither need or want. We'll see how this goes. Okay, so I'm pretty appalled at myself at making that. This was me outside the venue. So actually, when I arrived, it's this beautiful, very kind of minimalistic building. My first kind of thought when I saw it was it looked a bit like an art gallery. And actually, I walked in this beautiful atrium. Everything was very Scandinavian. The waiting room was pretty busy. I don't know why that surprised me, because I knew that the waiting list was huge, so it would have been very surprising if I'd been the only person there. Everything was painted either white or slightly sickly yellow, and it gave me a little bit of Squid Game's house vibe. I was half expecting to turn a corner and find someone dressed in a luminous pink costume. But it certainly was an experience that was much more akin to going to a high-end spa than going to a health facility or any hospital that most of us would be familiar with.
I think this is really interesting because I think this is capturing the imagination of, well, it certainly captured my imagination, but I think this is quite a clever approach to offering a service, because everyone likes beautiful things, don't they? But I found myself looking at this and being like, wow, what is this? Like, what is this new, like you said, art gallery clinic thing? And I didn't really understand what they were doing, or, this mysterious scanning, but I just found myself going down several rabbit holes, just odling at these beautiful pictures that they've taken of this clearly beautiful site. And I haven't obviously been to it myself, but I listened to one of the founders, and he gave a few really interesting tells. He talks about how he is a massive Stanley Kubrick fan. I think it just fits straight out of one of these films, doesn't it? This very plush, kind of mysterious, futuristic interface. And I think it's really clever. He also talks about in the podcast how they don't do any marketing. And I wanted to kind of like challenge him on this a little bit, because I thought, well, actually all of this is marketing, but they're not doing any paid marketing. They're not doing any adverts. They've just got lots of very beautiful clinic, lots of online beautiful pictures, and I guess they are allowing people like yourselves to go and experience it and then talk about it, and that's probably maybe quite a clever way of marketing. But this is something that doesn't really need to market itself, does it? Because it just does it naturally.
Yeah, and there was certainly novelty to this, the novelty value and the intrigue in particular. To continue my story, there was a very brief stay downstairs in the atrium, in the waiting room. I was then led up to the top floor. Again, to follow that theme of being in a spa, I was asked my shoe size and then given some appropriately sized Crocs.
Slippers,
slippers. I think I sent you a photo, didn't I? I was then taken through to my clinic room. I was met by a really lovely nurse, and I think probably just worth saying at this point, everybody was hugely friendly, hugely professional, and really worked to give you that extra experience, I suppose. So we went into a changing room. I changed into what was very much in keeping with like a spa dressing gown. So I was wearing my funny Crocs, a dressing gown. I got to plonk my phone on a very nice wireless charger, which again, little points, but it maybe they make a difference. Maybe I'm just really materialistic. I don't know.
Did you get to keep the slippers and the dressing gown?
No, I didn't.
Right. So they're kind of giving those back and washing them. That's interesting.
Yeah, interesting. We'll cut that bit out because that was a really boring point. Okay, so from that point onwards, it got changed. I was then taken through, and I guess the scan started. So the first thing I did was this skin assessment. So this was very much promoted as a way of using AI and a huge number of cameras to take over 1,000 photos of seemingly every single part of your body to give you a really good skin assessment. So I stood in this kind of weird cylindrical scanner. I had to hitch up my boxer shorts as high as I possibly could, which is a look that I'm glad that no one else could see. And then there was this incredibly bright light that made me think for a moment that I might have died and this was the end. But actually, 30 seconds later, there were a load of flashes. I turned around, did the same on the back, and it was done. And that was the first part of the scan done. So, and we'll talk about the results of that a little bit later. But that was the moment that I realised why they had asked me to wear non-see-through dark underwear.
I think for the price point that they're offering, I found this quite interesting that they are doing this skin assessment, because you can go and pay for a kind of full dermatological mole check, can't you? Where either there's a dermatologist or a dermatology specialist nurse kind of examining your whole body with a dermatoscope, or you can go and get your whole body scanned by a machine that's using AI to do this. And actually, I think the price points both of those things are about £250 to £350 just for a skin assessment. Obviously, the Neko Health scan is just under £300 currently, and this is part of it, isn't it?
Yeah, and I think it will come on to that, but I think it was a part of the scan that I was actually really impressed by. The reason being is that when all of this data was presented to me, the quality of the images of these imperfections or moles or freckles or whatever they are that they can bring up on the big screen to show you is astonishingly good. Interestingly, the assessment itself does also include a doctor who looks with a dermatoscope on any moles in particular. They take some photos of those. So there was one taken that they found on my foot that they thought might be of concern. That was then sent to a dermatologist, and I received a message later that day to say they'd looked at it and they weren't concerned. So it does feel very thorough from a skin point of view. It does make me wonder as to how accurate the AI modelling is, if they also involve the dermatologist. But I guess, as we know with AI in medicine, it does often require a pilot or someone to monitor it and actually interpret those results.
There's a thread I want to pull on there, because this sounded odd to me. This sounded a bit jarring when you told me about this story of how you've got this really fancy camera that takes a gazillion pictures in a heartbeat while you've got the biggest wedgie of your life. Why do you then need a dermatologist? Why do they then come in with a dermatoscope and then take more photos with a dermatoscope with a doctor and then send it to a dermatologist? What is the purpose of the first bit? And the thread I'm pulling on here is my suspicion about some of this health screening on a whole, is that it sounds to me like this is just data gathering, and that the first bit is not really a proven technology yet, but they're maybe trying to just gather data to see if the AI algorithms are actually good at detecting what is then confirmed by a doctor with a dermatoscope. I don't know that, but I have a suspicion that sounds like what you're describing. Like, why would you have those two processes if the AI big fancy camera did its job and you have these beautiful images like you said? Why do you then need part B and C?
Yeah, I think it's a really fair point. The only thing I can think of was whether, there certainly was a lot of talk about this being a frequent thing. So the expectation is that if you have one of these scans, you might return in 12 months' time and have it repeated. So I guess having a mole map, or at least a point of reference to look back on, certainly in terms of giving all of those images, would potentially be very useful.
Yeah, that's a fair point. I guess repeat iterations of this, it then might be able to detect subtle changes that weren't detectable. Yeah, that's a good point. Okay, then what happened next?
So then I went through and lay down on what felt a little bit like a surgical bed. I had my bloods taken. I was then assessed for my grip strength on both hands, which I wasn't expecting. And actually, it was quite fun, this whole process, really not knowing what was going to be coming next. It was no surprise, really, to me that my right hand grip strength was seemingly lower than the normative data that they had, but my left hand grip strength was a lot higher, being a lefty myself. But I think the basis of this, and I think there is some truth to this, that actually that grip strength, I think, correlates quite well in terms of longevity and future health. So actually those who have good grip strength, that's a sign that you're potentially in a good way, and vice versa. So again, it's not something that I would routinely do in my practice. I doubt it is for you as well, but actually looking at the data, there does look as though there's quite good evidence for this.
Again, coming back to the podcast, listening to the founder, he talks about how a lot of the current healthcare technology is designed for disease detection rather than preventative screening. It sounds like they're trying to develop all of these new methods that are cheap and cost effective, and it's clearly, the price point is very reasonable here, isn't it? And the things like grip strength, I guess, are quite easy to do. The thing that I'm a bit puzzled by, is reading through your report, Mike, is that yes, they've picked up on your right being a bit lower than their normative data, with your right hand, and then their comment underneath is this might be something that you need to work on. It feels like that is disconnected to the health screening. What I mean by that is that I think a grip strength is a general indication of your muscle mass systemically. Are you sarcopenic? Have you lost too much muscle? Are you losing grip power more so than you should do for your age? But then they just talk about how, actually one hand was a bit weak. Maybe you need to go and do a few kind of grip squeezes with that hand. That's kind of missing the point, I feel.
I'm glad you picked up on that, because that thought exactly crossed my mind. It was sort of the wrong way round, wasn't it? Rather than saying, actually, a grip strength is a good indicator, it was saying you need to work on your grip strength, as though that was what was important.
Yeah, of your one non-dominant hand.
Yeah. No, I thought that was an important point. So to then move us on, I guess. So I then had my intraocular pressures measured. I mean, this took bloody ages because honestly, I don't know about you, but I just cannot keep my eyes open when they blow that puff of air in your eyes. So I think the poor nurse was getting quite frustrated by me just repeatedly blinking. But again, I think there's some evidence and some use for that potentially. Again, it's not something you would necessarily get, or you would get in many health screens or assessments by a doctor. I then got my blood pressure done on all 4 limbs. I had a 4-lead ECG, and then it started getting a little bit weird, because then I started getting things that honestly, it was a little bit like science fiction again. This disembodied voice started talking to me in a very calm tone from the ceiling, saying that they were starting to use lasers to assess the distance between my sternal notch and my femoral artery. And then some lights came down and assessed my right wrist, where they gave some really beautiful pictures. It reminded me of the Matrix for some reason, but some beautiful pictures of my vascular system of my wrist, or certainly maybe a mock-up of what that might look like. I don't know. And I thought, I've got to be honest, at this point, I was kind of calling bullshit a little bit and thought, well, this is all just very performative, very kind of showy. It's really interesting because then looking at this in a little bit more detail afterwards, essentially what they were doing here, so that first laser thing was measuring what we call the estimated aortic pulse wave velocity. This is essentially your aortic stiffness. It is quite a good indicator, actually, in terms of your risk of cardiovascular issues down the line. And actually, the laser radar technology that they mentioned just sounded ridiculous to me. But actually, there's some evidence behind it. It seems to be a very safe and quite effective way of estimating this. And then when we're talking about the kind of weird image on my wrist, that's actually looking for peripheral or shallow blood concentration using something called spectrophytometry. I don't know if you've come across that, Matt, at all. No, me neither. But essentially, this is because superficial blood concentration apparently is a key determinant of tissue viability, local metabolic exchange, and the effectiveness of topical therapies, whatever that means. So it's if it's impaired or dysregulated, it's implicated in a range of pathological processes, impaired wound healing, chronic inflammation, vascular disorders. So I'm less kind of certain about that one. I don't know, and I may be wrong here, but it felt, and I think we're going to come back to this theme, but it felt like an odd thing to add into a general health scan.
Okay, so yeah, some really interesting / slightly jargon heavy fancy stuff going on there. I guess the merits and the evidence behind that, like you said, are interesting, and like the lasers detecting the stiffness of it over your aorta being quite accurate, and the relevance of that to cardiovascular disease. I guess my pushback here is, has anyone studied this and the merit or the use of this compared to much more simple measures such as your blood pressure? And I guess it sounds like they're doing the both, aren't they? But they're doing blood pressure in all 4 limbs, which seems in some ways a bit over the top. I think the detection of disease from measuring the blood pressure in all 4 limbs versus just one, what you're going to gain from that, I think, is limited in terms of the detection of disease. But I think it's interesting that they're studying this. And I think it's interesting that they are looking at cheap ways of measuring things that we don't study generally. But I just would push back and say, is this proven yet? Is there any benefit to this? And I hasten to think that there probably isn't. And again, coming back to the point I made about them gathering data, is I've got this nagging feeling that this is a very clever, very beneficial experience, but a lot of this is data gathering, and they are testing self-confessed proprietary technology that their in-house engineers have developed. This is new stuff, and they're just testing it. They're just gathering data, and I think that's fine. And maybe there will be further iterations of this, and it will become more useful, and it maybe will confirm or refute some of the technologies they're trying. But I'm curious to know how upfront they are about that from the outset. Like, do you have to consent to all of this data being collected and gathered?
So I think, as far as I'm aware, the only thing that I had to do was fill out a kind of brief health questionnaire in terms of underlying issues, things that I was aware of, which all, to be honest, was a little bit vague and felt a little bit difficult to follow the logic behind some of the questions. On their website, they do have something quite interesting that says, obviously, we would like to use your data to help train our devices and improve our service, but you do have the option to opt out of that, and that's what I did. So unfortunately, all of those images of all of my moles and imperfections and weird hiked up underwear are going to not be available to Neko.
Sure, fair enough. Tell me about the bloods then. How did that work, and what kind of results did you get?
Yeah, so this was at this stage. The very lovely GP walked through a door that I haven't even noticed. I thought it was a wall, and then suddenly someone appeared through the door, and she was dressed in quite sort of futuristic attire. She was really nice and explained exactly what she was doing. At that point, she had to listen to my heart. She had then, as we mentioned, a bit of an inspection of any particular freckles or moles or whatever, and had a dermatoscope and had a look at that. And then I was taken through to a separate room and sat down in front of a massive screen. And it was at this point that you have your kind of half an hour with a GP. And I think this is, again, one of Neko's big selling points, is that rather than just being given all of these data points, and rather than being given all of this information, which a lot of companies do, and then you don't know what to do with this data, or you end up going to your NHS GP who rolls their eyes and thinks, how am I meant to deal with this in 10 minutes? They offer that half an hour with a GP who will go through all of your results. Now, it was barely 10-15 minutes, so the blood results were already back. This was clearly kind of point of care tests in terms of being able to get the results back so quickly. And actually she sat down and brought up a terrifying avatar of me that had been generated by all of these cameras. Honestly, it was like something out of a horror film.
Did you have a wedgie?
I had a wedgie. You could see my skin graft like bulging out from my leg. It was just really disturbing. I kind of a little bit scarred by it, to be honest. But she sat me down and she talked through all of the data points that they'd got. So she explained all of the blood results. It was only at this point that I admitted that I was a doctor, which I felt a little bit guilty about. I probably should have mentioned that earlier. But she talked through my blood results. She brought up a couple of images of some moles taken by the cameras. Again, as I mentioned, they were just impeccable quality and was really quite impressive. Talked a little bit about blood pressure, a bit about BMI, quite basic stuff, I guess. Interestingly, this was one of my takeaways, is that whilst they measured a lot of different values, so full blood count, white cells, cholesterol, they didn't measure platelets, which, that's fair enough. But I have essential thrombocytosis. That essentially means I've got a load of platelets and way more than you should normally have. And that would have if I didn't know about that already, that would have been completely missed. And it's just interesting. And I think that was one of my takeaways, was that I come out with all of these millions of data points and this information. And yet there's a scenario here where I would have had a disease that needs active monitoring and it would have been completely missed.
Yeah, and that's a fair point. I guess I'm now defending Neko there, and would be saying that they're not claiming to rule out all disease, are they? They're developing a kind of system and a technology that helps detect common things and help for people to live better. And I guess they're not claiming to replace a health service currently, are they? They're not saying, oh, we're your new GP and come and get your health screened with us.
Yeah, absolutely. And I think also probably I did get the impression, speaking to the doctor, that that this is the start, and actually they will start developing many more data points, provide further services. I think just a couple of points to add, just because I was nosy and started asking questions. I was asking kind of what happened actually if any issues are identified, because I really want to get to the point where do they actually just send them back into the NHS system? And the answer to that is no. So they actually have some quite good onward referral processes. Now, obviously, the point here being that you've already spent a lot of money on a scan, that doesn't necessarily mean you're in a financial situation where you can go privately and see someone if an issue is found. But what she did add, which I thought was quite interesting, is if that 4-lead ECG demonstrates any abnormality, they then do a 12-lead ECG. And again, if that shows any abnormality, you get an echo done included as part of the price, which I thought was quite impressive.
Yeah, that is impressive, isn't it? Because that privately it's about £1,000, or somewhere between £750 and £1,000. Why on earth would you do a 4-lead ECG, and then if that's abnormal, I mean, it's surely cost effective and simple just to do a 12-lead ECG, particularly if you've got AI algorithms interpreting the ECG.
I think maybe it's time, and I think that's again one of their selling point, is that the whole process from arriving and leaving is within an hour. And I think they mentioned that repeatedly on their website. So maybe it is purely a time critical decision, really.
Really, really interesting. Okay, so that's a bit of was that the end of it? And then you have this chat. Are you given something to take away?
Yeah, so not given anything initially, but I was told that my results would be emailed to me by the end of the day, and actually they appeared by the time I'd made it out of the front door, basically. And the whole process was like super seamless. So I had these results, and I think I shared it with you, but I just got a kind of breakdown. Now, it didn't provide me with all of the images, which I was maybe hoping that they would have done, but it did give me a breakdown and actually some also kind of personalized advice. So some of it was quite generic, exercise, eat well, but then there were some specific things saying, look, your BMI is a little bit high and you need to be focusing on your stress levels and stuff like that. So,
and your right hand.
And my right hand, I need to improve my right hand grip strength, exactly. But yeah, so that was the whole process. And it was fascinating. And I sort of was there thinking, I wonder what cynical Matt is going to say about this. But actually, I think I am quite excited to talk about our views on this, because I've got thoughts. They're not the thoughts that I had when I went in. Be interesting to hear your thoughts on it, though.
I mean, I've already had an argument tonight with my wife about this, because I was talking through some of it and she was chastising me for being cynical in a nutshell and how I need to listen more and be more open-minded. And I guess I'm going to caveat what we're about to say by saying, look, I am very much in support of this. I think actually I've not had it done myself, but hearing you talk about it and what they're trying to do, I'm on board, and I think this is a good movement. There are a few things that concern me about it, but I think from a kind of top level, helicopter view, I think what they're doing, what they're trying to achieve here, should be congratulated.
Yeah, definitely. And I think that was kind of my takeaway. I think, again, the caveats, look, it costs almost £300. There's a huge waiting list for this. This is not accessible for most people, let's be honest. I think it is playing to a demographic of probably reasonably young, health-conscious people who are concerned about their health and really like tech and data points. And I think that is a huge market. I mean, we've talked about these in terms of data on previous episodes of the podcast. We all love our kind of Garmin's or our Whoop devices. So I think I can see why this is so popular. I would say anything that is getting people interested in their health and providing them with some sensible advice about what to do should be applauded, I think. And I think I saw an article that said that they estimate that 1% of the people that they have scanned so far have been found to have a very serious or potentially life-threatening medical condition, which is quite impressive, I think. I think particularly with mole checks, we as GPs don't have time. A 10-minute appointment assess everybody's moles. So you're paying privately probably to get that done anyway. We know that rates of skin cancer are high and are likely to continue to rise. So I think that was a really positive point. I think there was an element of perhaps this is quite performative. We talked about that at the start. It's this kind of spa experience. It's all of the tech. It's amazing, beautiful, huge screens and pictures. So I think that's a big part of it. If that gets people to have health assessments, is it a problem? I don't know. But I think that certainly was a big selling point. We discussed this off air. What is it adding other than a good assessment via a GP? And I think, I don't know. I think maybe time. I think there are some useful data points. There's some stuff that we talked about that I'm not sure is hugely relevant. I think actually just testing someone's blood pressure is probably the most effective thing you can do, as opposed to, looking with laser radar technology at your PWV. But look, who am I to say? Maybe that is the future.
Yeah, I think that's, I guess, one of my first points I want to push back on, and I'm going to get some heat for this, but everything that happened to you in that 1 hour, I'm wondering if that couldn't be replaced by, say, for example, a competent GP trained with a dermatoscope, assessing your weight, your height, looking at your skin, and then sending you for some blood tests after checking your blood pressure. And I think we could argue this for a long time, but a lot of it, like you said, sounds performative. And I think a lot of this could be done without the fancy tech. Now, the obvious pushback to that is, but surely you've got all these people who are now engaging with it and it's a much more in-depth assessment. But I think a lot of the crux of this is Yeah, but could all of this be done much simpler? Is the problem here that we just actually need to get people engaged with their health and be more proactive with seeing a doctor? Or is the problem that the doctors don't, like you said earlier, they don't have time to do this? So yes, that issue about a lot of it being performative, and I think that's necessary for their approach here, though, isn't it? In terms of generating this hype, generating this interest in getting people to queue round the corner and join the 100,000 people on the waiting list to get this done. And I think it's a necessary part of it. And I also don't necessarily think it's a problem, as in going and having a Stanley Kubrick kind of 1 hour amazing spa experience. I'm jealous, and I still, despite slagging it off just now, I still want to go and have it done myself.
Yeah, you do sound quite jealous. I've picked up on that.
The other thing I want to mention is this kind of proprietary technology. Listening to this podcast with him talking about this, he is quite, like I said earlier, self-confessed that this is developed in-house by their engineers, which means this is new. This is completely novel. They've generated these machines to test certain things. I don't think there's any evidence that this is currently a useful measure. I think it may become useful in the future by repeated iterations and by studying thousands, hundreds of thousands, if not millions of people over the next 10 years, which it looks like they're on track to do. But it almost feels like a bit of an experiment. And my concern with that is what happens in 10 years? What happens when they've got all your data and they've now got this proprietary technology that Neko own, and that you have to go and get it screened with them because it's them who've got your data and it's them who've got the lasers that scan your neck. And obviously that's great that they're developing this new technology, but who owns that going forward? That's the bit that I'm a bit curious on. I don't know. Is that a problem, do you think?
Yeah, I think it's a fair point. I mean, look, personally, if they want to keep pictures of my weird avatar and my multiple imperfections on my body, then they're very welcome to. But no, I think a fair point to raise. It just, I guess, adds a little bit to the mystery and the intrigue around this. I think just to kind of come back on one of the points you said earlier, I think a decent GP who is comfortable with a dermatoscope and good at health promotion can absolutely do this stuff. And I think there are loads of doctors who will do that. The reality is that's also going to cost money, because I think that's going to be in the private sector if you want a full health assessment. And, there's been lots of talk, isn't there, politically about how we need to move from a reactive health service to something that's a little bit more preventative. So, whether that is offered on the NHS via GPs in the future, I don't know. I mean, I know everyone who turns 40 gets invited to a health check where they'll get their blood pressure done, check the weight and the height, and do some bloods as well. I guess this is a more advanced version of that, really, isn't it?
Going back to the when you leave and you've come face to face with your avatar, and you've got the GP outlining some of the things to work on. Is there any kind of specifics that are actionable, or is it a case of general stuff that we probably all actually know deep down?
Well, I think the report that I got sent through is quite generic advice, but then I guess it's worth adding that actually they didn't really find a huge amount wrong in my scan. I'm reasonably healthy, so they probably didn't need to go into more details in terms of specifics. I mean, there is lots of just general advice about regular cardiovascular exercise, balanced diet, strength training, good sleep hygiene, all of this stuff that we all know we should be doing. They obviously mentioned kind of the skin issue and the fact they'd sent off this one image that was going to be looked at by the dermatologist, and then that was followed up. So yeah, look, it is all quite kind of generic, but I do wonder if there were particular issues that were found, whether there would be perhaps more in-depth advice.
Okay, Mike, I'm going to put you on the spot here then. I guess you've talked us through the journey. We've tussled through what is clearly an early company, and clearly a company that can grow. And I think we've given a nice overview of that. We've maybe highlighted some of the imperfections and how future iterations might be better and even more informative and enhanced. But I want to know, you've been there, you've done it. Are you going to go again? And yeah, what are your kind of concluding thoughts?
So there's some real positives I brought out of it, and actually a couple of things that I thought were seriously impressive were, and I hate the phrase, but the patient journey. So what happens from when you enter the building to when you leave, and any follow-up. And that was just so seamless and really quite impressive. And I'm not someone who's hugely impressed by these things as a whole, but I thought it was all really seamless, really smooth. Everybody was great and really professional and really lovely. Will I go again? You know what? I hadn't even considered that.
You hadn't considered that? Isn't that the whole point? It's like
probably
future iterations.
I think, I don't know, maybe I need to be more health conscious doing this podcast after all. I think that I do need to be more conscious of my skin, and actually maybe I would consider it for that in particular. It's all of those days we spent surfing on Maroubra Beach, Matt, that without the factor 50 that has done the damage. So I think that part of it I would be very tempted by. Look, I think the other stuff, I mean, I probably will be a bit more conscious about getting my bloods done and checking my blood pressure, but I can do that quite easily myself. So I guess the benefit of it for me doesn't perhaps mean that I'm going to go back in a year's time, but I could see how that's very attractive.
And I guess that's an interesting point, isn't it? Because you said how they didn't really find much wrong with you. So I guess the incentive to go and see if you've made any improvements on whatever metric it was that you weren't doing very well with is less so. It's less relevant for you because it was kind of okay in the first place. And I'm wondering if that also then is that false reassurance, like you said, is, I've had my Neko Health scan, which means I'm good for 5 years, but it's actually missing the platelet disorder that you've got. I'm not going to criticize them on that basis, but I'm wondering if that, I guess that might play into some prospective patients.
Yeah, and I think, definitely. I think actually the only other thing I would add is that we talked about cholesterol on a previous episode, and given that I am the Beyond the Limits guinea pig, listeners will remember that I had my cholesterol done prior to that, and actually the results were quite a lot better in the Neko results. Now, I don't know whether that's because I've gone for like one more 10k run and I'm eating slightly less chocolate or not, or whether the results are not as accurate. I honestly don't know. Maybe I'll just pretend it's the former. Matt, you've been playing the kind of role of the slightly cynical, grumpy skeptic here, as usual. But has anything, since I've been and we've talked about this and you've done some reading and research, has anything kind of changed your mind on this? Or are you still remaining a little bit skeptical?
I hate to be labelled the grumpy skeptic because I want to push back and create argument and create interesting debate here. But I think I said at the outset, like I'm all for this. And I'm a little bit troubled by the whole data thing, and that does sound a bit like an experiment, but I guess, these things have to happen for new things to develop, for new technologies, these new ways of monitoring our health. We have to experiment a little bit. And what I loved about listening to this guy talk on the podcast, he was talking about how MRIs are very expensive, they're very time consuming, and they're also used for the detection of disease. They're not really very good at health screening and preventative, proactive healthcare. And I hadn't really thought about it like that. And I thought, actually, that's really interesting. An MRI is just a snapshot in time, and it will tell you if there's a lump where it shouldn't be. It doesn't tell you much more than that. And I loved the ambition of the company to try and find cost-effective ways, simple ways, non-invasive ways that we can monitor our health better going forward. And if that requires a bit of a huge population experiment to gather that data and to find new ways in detecting disease in early stages, then I'm totally all for that, and I will totally eat my hat and throw my cynical, grumpy Matt in the bin.
Okay, good stuff, Matt. I enjoyed that. That was good to talk through. As always, guys, leave a comment, leave a like, follow us, and I'm off to work on my right hand grip strength.
Cheers, Mike.